Recording in progress.
You just go.
Good evening, everybody. Good evening, everybody. Welcome to the December 11th, 2023 meeting of CB11's Human Services Committee. My name is Isaac Scott, and I'm the chair of the committee. This meeting is called to order at, it is 6:05 p.m. Tonight, we are joined by Marlene Pierre, the staff liaison to our committee. In order to conduct an efficient meeting, let's observe a few ground rules. One, no one may speak until granted the floor. CB11 members, if you have a question about board business or wish to make a motion, please raise your hand and wait to be recognized. To raise your hand through Zoom, click the participants icon and you will find the raise hand function there. If you have technical difficulty, click the chat icon and relay your difficulty to the staff. Members should not engage in a back and forth discussion. The chair will recognize the next person to speak. The chat should not be used for CB11 business or questions about agenda topics. All such remarks should be made on the record when recognized. Please keep your questions and comments brief and on topic to the discussion. Members of the public, if you have a question or comment about the subjects on the agenda, please raise your hand and wait to be recognized. And as soon as our committee member comes back from opening the door, we will do roll call.
And I'm asking everybody to say something. So we have to get nice and cozy. Don't just come around. I'm sorry to get this.
We will now take attendance by roll call. Thank you all for your patience. Marlon, we're ready.
April Autry. Present. Mark Perkursky.
Present.
Kareem Kauser is excused for this meeting. Brandon Gillespie.
Present.
Jennifer Meyer.
Present.
Alicia Miranda. Isaac Scott
Present.
and Robin Stration. Present. You have a quorum, Isaac.
Thank you. The agenda for tonight's meeting was distributed ahead of time by the board office and was posted online. If there's no objection, we will adopt the agenda as stated. Committee members, if you object to adopting the agenda, you may raise your hand to be recognized. Okay, seeing no objections, the agenda for tonight's meeting is adopted. The minutes from our last meeting were distributed to the committee members ahead of time by the board office. If there is no objection, we will adopt those minutes from that meeting. Committee members, if you object to adopting the minutes, you can raise your hand to be recognized. Okay. Seeing no objections, the minutes from the last meeting are adopted. And once again, I'll be taking the minutes for this evening. Announcements. We'll go right into our announcements. I am happy to announce that we have a new vice chair, Jen Meyer.
Yes.
We are very, very grateful for this new appointment. I know I am as a chair, but I am very confident in what Jen will bring in her leadership. I also am just happy to have more support, more help. But I think one of the things that I'm very excited about is this committee is in a lot of ways a new committee. And I think that we have a lot of potential to do a lot and make a lot of change. So I'm happy for the order and the structure that's being put in place, and I'm happy for everyone's contributions and welcome Jen to this position. I don't have any more announcements. Yes, are there any announcements from committee members in the room? Anything you want to let the public know about anything going on, updates about anything? If not, then I will turn to the community. Does anyone online have any announcements they would like to make? Are there any upcoming events that we should know about? Anything you want to share with the community? Seeing no announcements, I will transition us into our informational updates. Our first informational update will be from the Department of Mental Health and Hygiene. Do we have, oh yes, I see Ms. Ferrante on.
Hi, good evening, everyone. It's Pauline from the Health Department. So I just wanted to highlight the Health Department's new campaign called Healthy NYC, and it's really to tackle life expectancy in New York City. So prior to COVID in 2020, life expectancy was 82.6 years in 2019, and it dropped to 78 years in 2020. So let me repeat that. I apologize. I got my numbers a little bit mixed up. So in 2019, prior to the pandemic, life expectancy in New York City was 82.6 years. It dropped dramatically in 2020 to 78 years. A lot of it has to do with COVID-19, of course, but also we know that health disparities among the city impact different communities. And so what the city is trying to do and what the vision is to improve life expectancy to create a healthier city. And we tackle a couple of different indicators or health factors, including heart disease and other related diseases, screenable cancers, drug overdose, homicide, suicide, and pregnancy related issues as it pertains to maternal mortality. So those are some of the things that we want to improve so that by 2030, we will increase life expectancy to exceed 83 years. It's very ambitious, and I will be happy to send the report over to Marlene for her to share with the entire community board so you can see the report. It's on our website, and I highly suggest everyone go onto our website. I know we've received some complaints that it's not necessarily user-friendly, but we have a wealth of information there. I also wanted to highlight that we did update the community health profiles. It's in a kind of different format. So if you want me to come back next month to run through it, or if you want me to stay until the end of your meeting tonight, I can screen share my computer to sort of run through why it does look a little bit different. It's not in a very easily accessible document like it used to be, but it's more interactive. So if you'd like me to stay to the end of the meeting where I can share my screen and everyone is interested in that, I'm happy to do that. I can wait until the end. So those are my updates, and I'm happy to take any questions.
Thank you, Pauline. Would you like to do it now?
Sure. I mean, I don't want to take up everyone's time. So if other people have updates, I'm happy to stay until the end so that it could be a more robust look through.
Well, how long do you think it'll take? Because if it's going to be, it could be a presentation you give next month. That's cool.
Would you prefer a presentation or a quick run through? Because I can do a very quick run through now. If the other folks on the agenda don't mind just waiting a few minutes, I can share my screen and I can show you sort of what the new changes are to the health profiles.
We're still under 5 minutes, so if it can take a few minutes for a quick run through, that's fine.
Okay, sure. I will try and share my screen now, and then just do it super quickly. And then if anyone has questions, obviously I'll come back next month and do a deeper dive. So this is our main landing page. When you go to nyc.gov/health, you type in community health profiles, and it'll bring you to, I am not a robot. Oh, geez, sorry. Of course this happens. This doesn't happen ever until I am in a time crunch. Yes, so.
You're not a robot.
Oh my gosh, I'm so sorry. So it brings you to 2018, but this is not the latest. So I apologize again. It's a little bit convoluted the way to get to these community health profiles, but now we have new data. So it's like 21/2022 or 2020 to 2021 data. So previously it was in this nicely formatted PDF for everyone. Now it's in this much more interactive type of format. So if you are not computer savvy, unfortunately, it does seem a little bit confusing. So this is why I just wanted to quickly show everyone. So in case you wanted to share with your community, you can type in from here, and then here are all the chapters that you can look through. And then it just does take a few minutes just to pull everything up. So it gives you the breakdown, the demographics of East Harlem, and then it compares, to NY City as a whole, and then also Manhattan. So different health indicators, social economic conditions, housing, neighborhood conditions, etc. All of those are up top. And then it just sort of gives you like a general idea of where you stand as it relates to the rest of New York City and then the rest of Manhattan. And so it's like color coded in this way. But again, it's really helpful information for the community to inform sort of what your policy thinking is, or how to work with other agencies or the health department to sort of bring up, the health goals and outcomes of the community. So I really do encourage everyone to look through this document or through this website. And then should you want to try and download a copy, I believe what you do is you go down to this little print icon here, and then you click on specific sheets from workbook, and then you select all, and then it'll download an entire document in which then you can share that with folks. So it's much more easy to see. And then you can also print it out. So that's the best way to get it in that nice format that we're used to. But I think that our team wanted to sort of have it in this interactive way to make it more engaging for folks. So that's sort of the difference. And as you can see, it takes a while, but now that you know how to do it, you can do it on your own. I'll stop screen share and I'll let everybody else on the agenda go ahead.
Thank you, Pauline. I mean, if you don't mind, I would appreciate it if you could come back next month and, do a little bit more of a presentation on it where you could speak a little bit to how different community orgs could use the website to inform their work or whatever, fulfill all of those purposes for why the information is there.
Sure, absolutely. I'll be happy to come back and do a deeper dive.
Cool, thank you very much. I don't have any more questions. Any questions from any committee members? Any questions from anyone in the virtual space? Let's see. Okay, thank you very much, Pauline.
Thank you.
And happy holidays too.
You too, thank you.
Okay, so next set of updates will be from East Harlem Co-ed.
Yes. Hello, good evening. My name is Selena Hernandez, and I'm from the East Harlem Co-ed. Good evening, all. I hope everyone's doing well. I have a few updates. One is that the East Harlem Co-ed just finished their first cohort of emergency preparedness. It was a 3-session for small businesses. We had reached out to several organizations, including DOH, and nobody had anything specific for the small businesses in our community. And so we held a first-time cohort of 5 businesses where we went through several sort of scenarios and emergency preparedness sort of training. And so that just wrapped up. We're going to be following up with them, and we're hoping to open up a new cohort in 2024. So that's an update. If you know of any small businesses in East Harlem specifically that can take advantage of the program, is completely free. And it's a 3-session course with some follow-ups. So that is something we just wrapped up. We are also working on a hat and glove collection. We are at several hundred at this point. However, with the asylum seekers coming into the neighborhood and just people in our neighborhood, there's a big need in East Harlem and Greater Harlem. So if anyone's interested in donating hats or gloves or scarves for children or grownups, you may email eastharlemcoed@gmail.com. And then the last thing is we're having the last meeting of the year this Thursday. It will be in person. It will be at the Health and Action Center on 158 East 115th Street. And that is going to encompass a wellness component, but also we are co-hosting with the Department of Health and Mental Hygiene a training. And I'm sorry, give me one moment. I have to excuse me, I had something in my throat. I didn't want to share that with all of you. Forgive me. So this was not in our plan, but there's been a sort of increase in overdose. And so we're going to be having a Narcan training this Thursday at 4 o'clock at the Health and Action Center. It will be in the multi-purpose room on the main floor. All that we ask is that you confirm attendance so we have enough supplies for all. And that is also at eastharlemcoed@gmail.com. And that's this Thursday at the Health and Action Center, 158 East 115th Street. And then after that, we'll resume on the third Thursday of every month, starting January. And that's all I have. If there are any questions, feel free.
Thank you, Selena. I had a question about the cohort. What industries are those organizations that you train from? Just want to get a sense of what sort of organizations are taking advantage of the training.
Sure. So it's a range. There were, I want to say 3 restaurants. One is a storefront that sells various materials, bags. Most of them were located on the 116th Street corridor. And then the last one was a mobile cart that sells different items and fruits and vegetables and smoothies out of a mobile cart. So it was a range of businesses. And actually all of them were on the 116th Street corridor, which is kind of interesting. And it was a Spanish, I forgot to mention this, it was Spanish language because that was the big thing that we couldn't find, something that was Spanish language specific.
Can I ask another question? Did they express why they were specifically interested in the training?
They were interested because there's been a lot of, so it's been a range. So a couple of them expressed because of the increase in robbery. Another one expressed because of the increase in rain and flooding. They're concerned that they may be in a flood zone and may be affected, and power outage. So, but the flood zone was the biggest thing, with the secondary one being the robbery.
Thank you very much. Thank you.
Welcome.
Are there any questions from any other committee members? Anybody in the virtual space have any questions? Thank you very much, Selena. I appreciate your presence. Happy holidays.
Happy holidays.
All right. So our next set of updates will be from Borinquen Neighborhood Health Center. Do we have Dr. Aponte on? If not, he may be joining a little later. I know he's probably still working, so we'll hold space for him. So we don't have any cannabis related updates this month, so we'll transition right into our first presentation. Dr. Burke, thank you very, very much for your patience and in journeying to get to this point with us. So I will just preface really quickly. I met, Dr. Burke gave a presentation at Harlem Strong a few months ago, right? I think back in October or September. And based on the topic of health and behavioral health and for young people, I thought it'd be very, very helpful. It'd just be very informative if we knew about the organization, knew about their work, for referral purposes, as we start thinking about, get a better sense of the landscape, so we know how we can, refer our community to the resources that are already there. I was like, oh, she has to come and present on this. So thank you for accepting the invitation. And with that, I'll be quiet and allow you to give a full introduction of yourself.
Absolutely. No, thank you so much for having me. Happy to be here. I am the clinic director of the Home of Integrated Behavioral Health, which is a mental health clinic that's run through the New York Foundling, which is kind of an organization that's been around the city for forever. It's kind of been a giant in the child welfare world. But our work in the mental health services are a little bit newer. So our clinic has been open since 2011, but we've been only in East Harlem since 2019. So very happy to be here and chatting with the community more. I
Do you
can
need-
go. I don't know if you have our slide. I have them on mine as well. Do you want me to share my screen?
Please, if you have, yes, let us know.
Yeah. Happy to. Let's see. I'm not sure. Are you seeing
Your
the
slides.
slide? Is it still in the main PowerPoint view though? Like, do you see them on the edge?
No, we see it in presentation view.
Excellent. Okay, perfect. I usually am a Teams girl, so wanted to make sure I was sharing it correctly. So as I started to say, our Home of Integrated Behavioral Health is a mental health clinic that we operate out of East Harlem. We're actually right down the block from the Harlem Action Center. So we are on, we're 109 East 115th, so right near the corner of 115 and Park. We are a child and adolescent clinic primarily, so we work with youth technically 0 to 21 and their families. Our hours are Monday through Friday. We have late hours Monday through Thursday until 8 p.m. and on Friday we're open 10 to 6. And we can accept referrals from anywhere. So we can take referrals from other community providers, schools, foster care, ACS, and self-referrals. So families can walk in themselves or give us a call or email us, and we can take referrals from anyone. We do take just about every insurance in the city. And if a family does not have insurance, we will still provide services free of charge. We also have a full-time case manager that can support with getting families connected to health insurance. So this is a quick overview of our programs. We really started as our trauma-focused cognitive behavioral therapy program was really how our little clinic started. So we started out with this kind of one singular program and have since built upon it, have since built on that. Our services are still primarily trauma-focused services, although we have expanded that a little bit and have expanded our services to include more general services for kiddos experiencing anxiety, depression, trauma, and disruptive behaviors. So again, our trauma-focused cognitive behavioral therapy program was really kind of the start of our clinic here. It is for youth loosely aged 5 to 17. I don't believe in any strong cutoff. So if you have a 4-year-old that you're like, they definitely need TFCBT, you can still send them. Similarly, if you have an 18-year-old that you're like, I really think they need to do some dyadic work with their parent, happy to take them. It is a conjoint child caregiver model. What that means is every week we meet with both the youth and we meet with their caregiver. Caregiver can be a biological parent, foster parent, chosen family, really anyone, any person who is there to support the youth in processing their traumatic experiences. And the way that TFCBT generally runs, first half of the treatment, we are just talking about what trauma is and what it does. We're getting youth kind of used to talking about what trauma reactions are and identifying trauma reminders and just bringing those symptoms down. So giving them some coping skills to support. And then the second half of treatment, they get a chance to do a trauma narrative, which is their chance to tell their story of what happened to them. And ultimately, and ideally, we have them share that story with their caregiver as well. From that, one thing that I kind of didn't mention is our program and the New York Foundling at large really has been built on this idea of see a need, meet a need, that being meaning we really build our programming based on what we're seeing is the need in the community that we're working with. So that being said, our cognitive processing therapy program actually came from our work doing the trauma-focused CBT program. Sorry, we use a lot of acronyms. I will try not to throw them around too often. But cognitive processing therapy is actually an individual trauma therapy model that is really developed for older adolescents and adults. And the reason that we created this program was because we know that trauma is so cyclical and so generational. So we were working with all of these youth doing the TFCBT and working with their caregivers as supportive caregivers and seeing that the parents have experienced just as much, if not more, trauma themselves. So CPT is a pretty short term, about 12 to 16 weeks, individual therapy that is really focused on the impact of trauma. So we talk about, what trauma is and why it happened and what it means about us that we've experienced trauma. And then we explore these different ideas related to trust, safety, power control, esteem, and intimacy. This program is, the caveat here is that because we're a child and adolescent clinic, we can only take external referrals for youth aged 16 to 21. But then if a child is enrolled in the clinic, their caregivers or their family members would be eligible for this program as well. Another one of our newer programs that has been around for about 3 years now is our Identity and Acceptance program. And the INA program is a really wonderful holistic therapy program for LGBTQ plus youth and their families. And what's really wonderful about the INA program is that every kid who's coming into the program there's an individual therapy component and also a family therapy component. And all of the clinicians are also, their kind of foundational training is in TFCBT, so there's still a trauma-focused element there, but they have really wonderful, well-rounded services. We also have some groups and just a lot of connection to any services that LGBTQ youth might need. And our team is also really wonderful at doing consultations. So if there's any community providers or families that just have some questions kind of about how to work with a youth who is LGBTQ, or kind of how to work with families who aren't affirming in a child's journey. So that is one of our programs as well. I should have mentioned both our TFCBT and our INA programs. We do have bilingual Spanish-speaking clinicians. Our newest program is, again, we love an acronym, but our MAP CBT program is really just an approach to cognitive behavioral therapy that helps utilize evidence-based interventions to treat anxiety, depression, PTSD, and behavioral issues. This is the kind of most traditional regular talk therapy. This is, again, loose cutoffs, but we're generally working with kids about 5 years old up to 21. And it's usually for about 6 to 9 months, give or take some. And the real core of this program is that every client is working with their clinician to come up with the treatment plan. So we're working on what the youth want to work on. We also have the Circle of Security Parenting Group, which is a free 8-week group program for parents that's anchored in attachment theory. And the really cool thing about this group is that these classes satisfy the requirements for ACS or court-mandated family parenting classes. This is, again, one of our newer programs. At this time, we do have one Spanish-speaking clinician who is trained in the COSP group model, but we have not started running any Spanish-speaking groups, but we are hoping to do so very soon. And then the kind of last piece of the clinic is our psychiatric services. These are comprehensive psychiatric evals to explore diagnosis and treatment options and offering ongoing medication management. And these services are available to any youth who are enrolled in any of our programs at the clinic. So on here, I've included our email address. If you are interested in referring anyone, you can just send us an email there and we'll send you all of the paperwork for the families to fill out. And I just included a little summary at the bottom of who is eligible for any of our programs. I'm happy to answer any questions folks might have.
Thank you very, very much, Dr. Burke, for your presentation. I did have a question, and forgive me if you did cover it in the presentation, but I was wondering, like, how do you all define like trauma, or what's the threshold you guys use to knowing who you work with and who you don't work with? Not like that, but like that.
Yeah. No, I'm happy and thank you. Thank you for that question. You know, whenever I'm doing these presentations, I never know how in depth to go and how much people want to hear me blabber on about trauma. But you know, the way that we define trauma with the folks that we're working with is that a traumatic experience can be any big, scary, upsetting thing that happened in your life that changes the way you think, feel, act, and even the way your body acts. So we keep it a very loose definition for what trauma is, and that's, you know, it's not really up to us to define it, but primarily what we're talking about is, are there big experiences that have significantly impacted you and your behavior and the way that you see the world? When I'm talking to parents and youth, the way I describe a traumatic experience is that when trauma happens, it includes a loss of control, a lack of predictability, and a sense of chaos. So the work that we want to do in trauma therapy is to undo that. We want to provide as much control and predictability, and we want to limit chaos. And so as far as kind of what are the trauma types that we work with, I would say the vast majority of the youth that we work with have experienced physical abuse, witnessing domestic violence, and sexual abuse are kind of the most commonly referred traumatic experiences. Of course, with the pandemic, we have had a significant increase in youth who have lost family members to COVID and other traumatic ways. Also seeing, we also see youth who have experienced and witnessed community violence, and have also seen an increase in youth who have experienced immigration trauma as well.
Thank you. I don't have it. It slipped my mind, but I'll open the floor. Any other questions from committee members? Any questions from our Zoom space? Okay, I remember my question now. It was regarding referrals. So I remember you saying that you receive referrals from other medical professionals, but do you guys also refer out if you guys like see that there's an additional sort of like support or anchor someone else kind of needs to help in tandem with what you all are providing?
Absolutely. So, you know, first step before we get started in therapy, we're going to do a thorough intake assessment where we're really learning about the family, learning about what's going on. And then at that time, we're going to make a recommendation for one of our programs. In the case, it doesn't happen all the time. It doesn't happen often, but, you know, there are times when we're like, I actually think that there is a much higher need here for a level of care, or, you know, I know this other program that I think would actually be a much better fit, and we'll refer out at the start. But most commonly, we'll move them into therapeutic services with us. And if there are other needs, other things going on for the family, we'll loop in our case manager. One of the really wonderful things about our clinic is that we do have a full-time case manager that helps support our clinicians and our families, who is just really wonderful at looking for other, like finding and connecting to other services in the community.
Thank you. And am I right to assume that some of the young people may be parents themselves?
Absolutely.
Yeah.
Definitely. Especially as we see, you know, as we're able to see youth up to 21, we have many young parents that come work with us.
Okay. Yeah. That's great, and helping them not to pass down that trauma. Thank you very much, Dr. Burke, for your presentation. I don't have any more questions. Thank you. Thank you also for filling out the organizational assessment form. We have you in our sort of database of organizations that are here in East Harlem that we can refer people to. So thank you very much for taking the time to do that and for coming tonight.
Of course. Yeah, thanks for having me.
No problem. Happy holidays to you.
Happy holidays, everyone.
Okay, let's transition to our next presentation. Okay. So this presentation was placed on our agenda at the very last minute. I do apologize because we will be here that much longer because of it. This presenter is also seeking a request for a letter of support. So we'll hear the presentation, and then we will ask any questions we have, and then we'll go from there. We do not, I guess I'll ask this question a little bit later, but I don't believe we need to vote on anything this week unless you all feel so compelled, in which we can, or we can take the time that we need to look through. But this is a health and hospital presentation, so I'm not sure how much, it's up to you all, to the committee as a body. So with that being said, is Alyssa Ruiz on the line?
Yes, I'm here.
Good evening. If you are ready, you can introduce yourself. If you have slides, you can also use those slides at this time.
Yes, thank you. So good evening, everyone. My name is Alyssa Ruiz Nicholson. I am the Director of Community Relations and Engagement at CIR. We will not take up too much time. I'm hoping that we can get through our presentation rather quickly. I appreciate you accommodating us to join this committee meeting. I'm joined by my colleague, Lilith Clarkson. Lilith, do you want to introduce yourself while I share my screen?
Sure. My name is Lilith Clarkson. I am the New York Public Sector Regional Director for the Committee of Interns and Residents. So what that means is that I oversee our members and our programming at 8 H&H hospitals. And for this presentation, we'll talk about Metropolitan. So that was my way of killing some time while Alyssa figured out how to share the slides.
Thank you. Oh, okay, sorry. Just to preface, we did have a member, Dr. Connor Bracey, who had addressed the full membership board or at the general meeting a few weeks ago to bring up this topic about our contract negotiations with H&H. So just to go super quick about who we are, the Committee of Interns and Residents, we're a national local of SEIU. So we are sister local of 1199, 32BJ, and Doctors Council. We represent over 30,000 interns, resident physicians, and fellows across the country in 11 different states, with about 7,800 of those members here in New York City, over 26 hospitals. We represent all of the resident physicians in the New York City Health and Hospitals, and that's including the 235 resident physicians at Metropolitan Hospital in East Harlem. Just to give some background, these are resident physicians are folks that have graduated with their MD degree and they're just in their specialty training. So they are typically members of CIR for at least 3 years, depending on the specialty that they decide to pursue. We organize all, our goal is to organize all of the residents across the country. Residents work about an average of 80 hours a week. They are also contractually bound to their place of employment. And so that's one of the reasons folks don't really know that doctors are in a union, but resident physicians are in a specific special step in their journey to becoming an attending physician. So they're working 80 hours a week. They're still training. They're contractually bound to the programs that they match into. So if they're having any issues in that program when they start, it's not as easy for them to just leave and start a new residency, right? If you leave residency after being matched, you're kind of, you're really impacting or jeopardizing your career, risking your career if you decide that you want to change residencies. Once you're matched, you match. And if you try to rematch, that's really, really difficult. So 80 hours a week, if you divide their hourly wages across the actual hours that they work, a lot of resident physicians across the country are making either minimum wage or below. And so this is a really grueling time in the process to becoming a physician. And so that's why the residents are part of the union. They're advocating for themselves. They're making sure that their working environment is safe, that they have fair contracts, and so that they can provide quality care to their patients. So we lead by our values, right? It's about improving their education and making sure that they can be the best doctors that they can be to provide the frontline care that they provide. Advancing patient care, protecting and expanding healthcare access, implementing well-being measures for residents. So, making sure that residents have what they need to take care of their patients. So also just making sure that they're being taken care of. As I mentioned, advocating for themselves and their patients and engaging the communities they serve. This is one way of doing that. We also provide community programming at PS 30 in East Harlem on 128th Street. We do offer a program where we bring residents or the doctors into the classrooms there to talk to the kids about healthy opportunities and healthy living. So that's one thing that we do, but we do a number of community engagement programs. And I'm going to pass it to Lilit to talk about where we are with our contract negotiations.
Good evening. Good evening again. Thanks y'all for allowing us to have a little bit of time. Similar to many of, for those here or who have family members that work for the city, all of the city public hospital, public sector contracts expired back in 2021. Because of COVID, because of other unions, our negotiations were delayed. And so where we sort of are right now is similar to the pattern that the city is offering to other municipal workers. They're offering 3% a year. The problem for our members is that 3% a year, one, doesn't help to cover the cost of living expenses that folks deal with. The rent is too damn high. And our members want to live by their hospitals. So it's difficult for folks to live near Metropolitan Hospital when you're making, a certain amount of money per year. The other piece that is concerning is that if we accept the current offer on the table, it would make our members the lowest paid by an average of $5,000 by 2025. And this is sort of the critical and important part, is because our members come to this work because they're mission driven. They don't want to work at NYU, no disrespect. They don't want to work at Northwell, no disrespect. They want to work at hospitals that serve our communities, like East Harlem, like the South Bronx, like Central Brooklyn. And our fear, and we've already said this across the table, is that those candidates will say, you know what, instead of going to Metropolitan, I'll go to another hospital where I can serve the same community. So it would be a drain on to help support the patients that, again, this community comes from, and that's what we're looking to do. Next slide. So again, I'm not Dr. Connor Bracey. He put these slides together. Again, our members really want to be able to provide the best patient care without the financial stress. And what that really boils down to is that, we're looking for the city, and the city has about a surplus of $5 billion. Don't let them tell you something different. To help increase the cost of living for our members, but also, again, more importantly, not just about now, but the ability so that next year and years moving forward, that we're going to have the same high quality level of physicians in training that want to work at Metropolitan, that want to work at Harlem Hospital, that want to work at Lincoln Hospital. And we're really afraid that we'll lose that if wages fall behind. And like I said, they'll work at other places. So this is sort of what our big fight is about. Our fight is really that, to be able for our members to provide the care that this community, again, no different than Central Harlem, no different than the South Bronx, that the communities that y'all need, we need to make sure that they're taken care of. Well-being, compensation, that they're able to pay their rents, that they're able not to be worried about financial stress. Because I do want to be clear with everyone here. Next time you go to a hospital at 2 o'clock in the morning, or you go to the hospital at 11 o'clock at night, ask that doctor if they're a resident. Our members, as Alyssa said, are working 80 hours in the ED when you come in, when your child comes in, if you get taken up to the floors, our members are the ones seeing you, not necessarily attending. And so we don't want, and I'm saying this as the union, we don't want our members to say, I'm not going to come here because if I can't afford to pay my bills to take care of my family, I'll go somewhere else. Next slide. So we need your support. There's sort of two asks that we have, specifically as we are at the Health and Human Services Committee. We are looking for a letter of support to indicate that this community board supports your doctors and your physicians. Again, I know this community board is at Metropolitan. I should say the hospital is Metropolitan, that's the closest. But again, we also have members at Harlem Hospital for those that may take their families to go there. And so we're sort of giving our 2 cents and letting our voices be heard to say that we need the community support. Across the table, it's bureaucrats, right? They're not moved by logic. All they're moved by is, beans on the counter. So our members feel that it's important to let the city know that the community is behind them and supports them. And one of the ways that we would like to do this is through letters of support, saying that this committee and the community board says that we support our doctors to get the fair compensation that they need. Secondly, we're coming to you now to say that we're not just only asking for a letter of support, but in January, when we go back to the table, if we're sort of, again, stuck in the same place where the other side of the table says, nope, 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 that we're going to start doing rallies outside of the hospital. Not sure how folks feel about Mayor Adams, but Mayor Adams does not want negative publicity right now. And our members feel like they're getting a raw deal at the table and are like, hey, we need to come outside and speak to the community, have the community participate with us, have elected officials participate with us. Because like I said, at 2:00 in the morning in the ED, it's residents and physicians in training that are taking care of you, your parents, and your children. If you get taken into the hospital on the floors, our members that are taking care of you, and the city is not recognizing that. So I hope we didn't go too long, but that is essentially the two asks that we have for you all tonight. If there are questions, myself and Alyssa are open to all the questions.
Yeah, could you put that last slide back up, please? Could you? Yeah. If you could, thanks. So I had a question. So I just want to be clear on the ask. So, one, a letter of support that the community board supports their doctors receiving competitive compensation. And the second request, I'm assuming it's not one that's in writing, but which is one that possibly an informal request.
Yeah. The second one, we don't have dates yet. We are planning to do community rallies in front of the hospitals. And I say hospitals because we're planning on doing in front of all of 8 H&H hospitals. It would be, hey, we have flyers. We would love for you all to come out as participants to say you support your doctors. But that is a bit more informal as we don't have dates set up for the end of January and or flyers yet.
Okay, so for that one, I think that would be a better one to direct towards Xavier and Angel. Just because it is an event and it seems like you're seeking board sponsorship and collaboration. So that's who that request should go through them. Just so you know how to better get a quicker answer on it. I think you should
Appreciate that.
Yeah, no problem. I think let them know where you're at in the planning phases on there. And I know that some of us may attend as individuals. I don't know what that would look like with specific human services committee members being present. If I'm free, I'll be there if it is appropriate for me to be there. That's also something I want to speak with the chair and the district manager about just the point of it being a rally. You know,
Completely understand. Completely understand.
be out there, but when I have to be out there as a CB11 member, it's different. I gotta follow protocols.
I
So,
understand. I understand. I understand.
right now, regarding this letter of support, is there a timeline on it? Because I heard you say something like, if we present it to them and they say no, and it seemed like that was like a quick handoff and response kind of thing.
So I mean, ideally, excellent question. I mean, sort of where we are now is, we're speaking with community boards across the city, speaking to health and human services committees across the city. And so ideally, we would be looking for all letters to sort of all support letters to sort of be in by January. Obviously, we're in December. Holiday season is coming up on us, but our sort of thought process was looking to get letters in January. Also knowing a little bit about the process is that I know that even, if you all were like, yeah, we will give our support as the committee, we know that that still has to get approved by the full board. So our sort of thought process was, we spoke at the full board. We were then told, hey, come to Health and Human Services. Health and Human Services, backs this play, and we bring it to the full board. So our thought process in this would be to sort of have letters within the first 2 or 3 weeks of January that we would be able to deliver with other letters to the city to indicate support.
Okay, thank you very, very much for that. I think that, yes, I'm gonna go to questions in 1 second. I think that that's a great timeline for us. So with that, I'll segue to what I wanted to say to Ms. Nicholson. Please, I don't want you to think in any way the tone of my message was directed towards you all in any way. I know that there was a bit of a miscommunication, and I know it had nothing to do with you all, but I did want you all to be involved in that communication. Yes, the best thing, before we go to questions from everybody, the best thing would be for us is that during these, before now and the next meeting, if you could fill out the organizational assessment form so the committee members can learn more about, your organization. In addition, during that time, we can, yes, we'll review it and, oh, excuse me, you'll come back next month and then we can vote on it. And we could have it, we meet the second Tuesday and then full board is like the last week of the month or somewhere around there. So you could have the letter by January, or January is your timeline. But I would, just because this was an unexpected presentation, I don't wanna, as much as we do love to support all our interns, and I know you're right about that, who's working at 12 at night and 2 in the morning, so I know that's right. But we want to respect the process we sort of outlined for everybody, and that we would take the 30 days to review everyone before we gave the letter of support. So I want to honor that. So yeah, so that's what you can expect on the letter front. So you don't have to wait to the end of the presentation to know what would take place, the process. But I'll open it now to questions from the committee. I saw that Mark and Robin have their hand.
Thank you for your presentation. You mentioned that the other side is intractable in offering 3%, but you didn't actually say what you're asking for, or if you're asking for anything beyond the salary increase.
Excellent question. So in terms of our salaries, we're essentially asking for a one-time $3,000 equity bonus. And that one-time $3,000 equity bonus would help to raise the wages so that our members, again, would be at the same compensation as those that are at safety net hospitals, St. Barnabas, Brooklyn Hospital Center, hospitals of that nature. I talked about compensation specifically because that is the crux of what our members are looking for. There are other items that we do have on the table that we're currently negotiating for, things such as extra compensation for holidays, extra personal days. Again, our members work 80 hours a week and can barely take a personal day to do things like go to the DMV because they work on Saturdays. And the other piece that folks are sort of looking for is the ability to get overtime when they're covering folk shifts. So most of our proposals sort of this round do sort of relate to again the well-being to make sure that if our doctors are right, if our doctors are straight, we know that they're able to provide the best patient care.
Can you put that 3,000 as a percentage? Because it's hard for me to compare 3,000 equity versus 3% increase.
Got it. I can, if it's okay with you, I can send a spreadsheet with that information. If
Okay.
that's okay with
But you're not asking for things like a reduction in the 80 hours.
you. We're
You keep referencing the 80 hours, but that's not actually part of the negotiation you're looking to reduce.
No, it's not a part of the negotiation because it falls outside the scope. The 80 hours is not 80 hours for our members is not something that is mandated or can be negotiated in a collective bargaining agreement. It comes from the specialty organizations that say determine you have to work X amount of hours in X amount of days to be certified to be able to sit for your boards to become a board certified doctor. So unfortunately, we cannot negotiate for that. But trust me, our members would like that.
Thank you, Robin?
Yes, hi, thank you. Who is our letter of support going to be addressed to, and who do you share it with?
Okay. Excellent question. The letters of support that we are asking for would go to specifically two individuals. One is Dr. Mitchell Katz, who is the CEO of the entire H&H system, to show, and some of you all may be familiar with who that individual is. He sort of sits as one of the primary stakeholders. And the other individual to whom we would send that to this is going to get a little bureaucratic. The mayor's office has a department called the Office of Labor Relations. That department is the one that negotiates all the contracts on behalf of the mayor's office. So our letters of support, we'd be looking to send to Dr. Mitchell Katz, who is the CEO of H&H, and to the director of the Office of Labor Relations, again, to indicate support, not just amongst our members.
Thank you.
I have another question. Outside of CBOs, are there other organizations you're getting letters of support from? Other hospital-related entities that you may be getting here?
Yeah, so we've been so on that front, I think it's been CBOs, my fault, community boards such as yourselves. We're also looking at the hospital community boards, so the community advisory boards, they're called CABs. I was at the Metropolitan CAB meeting last week, and the director of your community board actually came and spoke, and I talked with him for a little bit. So we're looking there, and then also different advocacy boards that relate to patients and also to doctors. So there's an organization called NY Docs. We're looking for letters of support from them, and physicians for single health payer plan. So not just only community boards and elected officials, but looking at sort of the gambit that sort of covers and touches healthcare and patients.
I would also add, we will be seeking letters of support from labor as well, like some of our fellow labor, especially healthcare labor unions.
Okay. So lastly, would you be able to submit like a draft letter to the board?
Sure. You let us know when would be a suitable deadline for that.
Today is Tuesday, maybe next Friday.
So you're saying by the 22nd or by this Friday? Let me know.
I mean, if you can have it this Friday, that's fine.
Okay.
That way the committee has more time to look it over and, just boo it before we come back.
Yeah, I think That worked. We could definitely submit something by this Friday, or send a
Okay.
draft.
Okay, that'd be perfect. Any other committee questions from committee members? Any questions from anyone in the virtual space? Okay, I do not see any questions. Thank you both very much for your patience and your diligence in getting this taken care of, and we will do our due diligence as a committee to review all of the materials you send. I did in that email send the link to the organizational assessment form. Is that cool? Okay.
I'm sorry, I did get it. I did click on it and it said it wasn't active. So I'll try again, but it wasn't working on my end.
Okay, let me, while you are on, I'm gonna go to the website right now. Give it a shot myself. It is live, so, yes, if you could go back to our landing page on the website, the Human Services Committee page, and click on the link. It's on the bottom bottom left, the CB11 Human Services Organization Questionnaire. It should be live. It's a Google form.
All right. I'm gonna find it. I just lost because I was sharing my screen. Now now I don't know where anything is, but I'm gonna find it.
I'm gonna email it directly to you. Don't even
Thank
worry.
you so much. I appreciate that.
No problem. Yeah, so, with that, we don't have any more questions. I'll let you guys go again. Thank you, for your presentation and happy holidays.
Thank you. Same to you.
Thank you so much for your time. Have a good day.
All right, so it is now 7:07 and we are moving into our committee business. So we are on good time. So I'm going to take about 90 seconds to just recap some of what we spoke about last month regarding our organizing and strategizing our work, and then I'll turn it over to April, who created a beautiful spreadsheet that can help us track some of what we were talking about. So with that, last month, sorry, Jimmy. So there was the suggestion to create a Google Doc with contact info, people's expertise, so we can gather people's contact info, expertise, passion to learn more about what people want to do. In that conversation also what came out was that for each topic we decide, committee members can independently find like resources related to that topic, experts in that field, legal services, and more. On the topic of immigration, and I guess, yeah, this came up when we talked about immigration because Robin mentioned that immigration has been a topic that has been least talked about since her tenure here. So one of the things that came up there was like, who is here? What do we already have, and how can we connect them to the resources that are already here? So that was just some stuff that we spoke about. With that, I didn't do any work past reviewing what we looked at last month. So everything that was done, from last to now, perfect. Thank you very much. Even if you didn't do anything, thank you. I hope you enjoyed your holidays. But with that, I was hoping that we could spend a little bit of time just getting a little bit more concrete on how we want to move forward in the new year with respects to our organizing committee work. So with that, I am going to, if it's okay with you, Marlene, I'll share screen and I'll put up this spreadsheet, and then I'll turn it over to April to sort of walk us through it.
Okay, so there's multiple,
Should I make this a lot bigger?
I'll email it to everyone. I just sent it to Isaac first. And there's multiple tabs on the bottom. So the first tab is just who we are. And then I added a link to my LinkedIn, so if people want to do that, if they have a professional page or something they want to add, I think that's quite nice. And then I just have my professional background, so that's what I do. Any affiliations, things that you do, groups that you're a part of, outside community board, and then areas of interest and or expertise. So those are mine, and then if you want to add other things on the side. So that's fairly straight, and I can add a column for contact info if people want that.
Okay.
And so then this, none of it's filled out, but this is just like a calendar of December through June of next year. And then we can fill in what, like, big picture, if this is how we want to proceed, big picture topics that we want to focus on. So for example, if in January, we wanted to do immigration and migrants, then we can assign different people, or different people can volunteer to say, I really want to focus on this. And then whether it's looking at what are the resources that are available, who are the organizations, what are the different policies, is there opportunity for recommending policy or advocating for policy, or doing a health event or helping to sponsor, whatever it looks like, but for a particular topic. And then how we want to communicate it, what we're gonna do. Anyway, so that's just a calendar, just so we can put things there. And then a list of resources, this will be a lot more robust, but I just started with, this is straight from the CB11 website. So these are the big name organizations that we work with. But then we can have other lines, for, smaller CBOs, or there could be one food pantries or food support, mental health supports. But I think this is just a nice place where we can, and then we can link to different websites, and it's just nice to have a list of resources.
So like something like this probably would be like city agency. Then the next row could be like you said, pantry. Or whatever.
Exactly right. Just so we have a list.
Okay, got this.
And then programming ideas is really like this big picture bucket things that we think are important, or that we're interested in, or that we think are needs in the community. Actually, Pauline Ferranti, the second thing that she was going through, if people haven't looked through it, I'll email it when I email everyone this spreadsheet, because it's really good on the data specific in our community. So people were like passionate about, I don't know, anti-tobacco campaigns or whatever it is. There's just a lot of very good East Harlem specific data, and it compares it to both Manhattan data and then New York City data. And it's interesting because some things we do better, and then other things we have opportunity for growth. So this is really just for brainstorming. People can put whatever it is that they're interested in, think is important, whatever, and then you can add timing or notes. And then miscellaneous deliverables, what I was thinking there were things beyond, like, if you think it's really important for us to hear from a group, so whether it's presentations or if there's legislation happening that it's like, this is really important for us to form an opinion on, or write a letter for, or fundraise for, or give part of our budget for, just what else do we want to do?
For an example, something like when the mayor announced his budget cuts and you're like, hey, we should respond. Cool.
So that's kind of how it's structured.
Well, thank you very much, for putting together this spreadsheet. And we are free to, as we begin to execute our work, we are free to shape this and use it. We will have to shape it into how we will use it to make it manageable. The two things that I see that are probably the two things that are most pressing right now is that we are determining what topics we want to pursue every month. And then the other thing is preparing our budget requests for October. With that, I guess I would love to like dive into a discussion for about 15 minutes. We can get out of here at 7:30. But let's talk about for a second. I know maybe over this break, we probably just fill out our information on here. Me and Marlene will still go about creating the agenda as we have, because I don't think I don't know, I'm sure we have people waiting already, so we'll sort of go through who we already have waiting to be on the agenda and things sort of. So I imagine we probably will be selecting and putting people on this board to maybe about March. Because we'll have to figure out who we want to find people in my and have them, so that stuff. So yeah, those are the two things the regarding the budget request, I guess what I was thinking, and let me know what you all are thinking is, I guess, once we see, whose expertise is in what, maybe we can see who is willing or wants to take part in helping to prepare those budget, items, over time, not just one shot, but like who's willing to work on that over, time with another person, and myself, to just, cause we can't do everything at meeting time, we wanna go home. So, just being able to execute maybe, 5 hours of work outside of here a month collectively may go a long way, things like that. So, thoughts, what do you guys think?
I have a thought, and because I've always been interested, of course, in requests for funding that's important to seniors, for quality of life. And none of them have ever come to be, and we've had a person from DIPTA repeatedly say, we can't do this, we can't do this. How do I find out what they do with it? Because I'd love to get to yes. I mean, that maybe do I ask another community board committee? I mean, how do I find out?
That's a good question. Let's ask our administration here, but also, maybe let's do our own research into looking at.
I know one other I can ask on the Upper West Side, it's kind of like a center. But that's just one.
Maybe.
Yeah, I see a lot of similarities. And while we're on the topic, I know that, there is a big push there's a big light shown upon how dangerous it is, especially for seniors living in that. Broken elevators, broken lights, broken cameras, so maybe that may be the route we go.
And I think, to the point of it being a deliverable item or to do things, we might want to at some point bring in the public safety to see how we can, because perhaps we can bring those concerns to the liaison who gives a report there over time, and let them know this is a topic, or maybe we take a position, and we ask the public safety committee to go in on that position. Something to that extent, because I was thinking about lights on this block too in that same regard. I don't know why people come in here and there's no light. So yeah. Thank you.
Yeah, I think that's excellent. How I tend to think, it's just how my brain works, is I start very big picture. And so I think and this is why I like this, because the aging population is not a great passion of mine. It is of yours, and I think it's important. And so if we say, what is our role on the Human Services Committee? We want to make sure that they're safe, that they have access to the things they need to have access to. So starting there, and then looking at who's doing those things. Is it working well in other neighborhoods? Who are they working with? What do they have that we don't have? Who are they talking to that we're not talking to? But it's really starting from this big picture. What is the goal? And then what are the questions? Because my brain works very well if I know what is the ask versus starting from the granular details. Like I just don't start well with. But I think there's also an enormous role and opportunity for us to collaborate with our other committees, because I think public safety is a great example, but like all of them, but I want to make sure that we also are bringing something to them. Like we've looked at the data from wherever, and we know that this is how they're feeling, this is what's happening to them. They're showing up in the emergency room, they're showing up with their primary care providers, they're not going out for food, they're not having delivery, whatever it is. And then saying, here are some perceived gaps. What do you know? What can you tell us? And then really working, coming together.
In that regard, I think it's also, we should know that we have the freedom to create small surveys. You know, if we want to send it around to people and just have them press a few, select multiple choice, 5 questions, and then, you know, we can use that as insight as well. Just gathering our own data in regards to certain topics, something to think about. If the data is not already there or if it's outdated and we want to get our own, things like that. One of the things I definitely wanted to do is produce data. That was the reason for that organization setting. I didn't want to be able to produce our own numbers so that folks can't undermine the work we're doing with outside members or narratives about Zoom.
What kind of numbers?
I mean, I think when folks were folks use the whole specifically the numbers about East Harlem has this amount of addiction treatment programs, but has this much need. And they're really like, what is the need? You know, it's really like those numbers are kind of they're used, they were misused. I think, you know, I think that the need was never defined when you say, oh, we have too much programs to meet the need. What need are you speaking of specifically? Because if the needs, you know, vary or compound with other stuff, are you meeting those? So it's just, it was a number that was used, that I think was used arbitrarily. Just with y'all both at Columbia, so I know how how nitpicky you are with numbers and data. So I don't think that was data that was used correctly. I think it was used for the purpose of what the user wanted to express.
Another famous quote, Harry Truman,
What's
with
that?
3 kinds of lies in the world: lies, damned lies, and statistics. So.
I've heard that.
So yeah, but yeah, Dr. Brandon, what are you thinking? Dr. Corey, you out?
I'm just trying to get into the drive and I can't remember my password, so. Yeah, I agree. We should be vocal about what we're committed to, what we're interested in, and knowing that will help us figure out how to allocate resources, human resources, and get resources if possible. But yeah.
But is our goal to find multiple different focuses and sort of, as you said, devote a meeting to each of them, or to find a more concentrated area to actually act? Because from the last conversation, I thought that's what we were more headed towards. I actually thought that the immigrant explosion in the community was sort of what we were talking about, which is fine if we want to expand that and look at senior needs, because there are no end of human service needs in these
I won't decide that on my own, but I think that yeah, one of the things that yes, immigration is something that I really want to pursue next, but I also want to pursue things related to the Asian community, because I know that it's been, I've heard Robin say this a lot, you know, and I have also worked with with some of the work I do with formerly incarcerated people. A lot of them are Asian. You know, I work a lot with released Asian people from prison. So I understand that you know, that demographic, the need of that demographic is really good. And so I don't, you know, and there's other social service needs in these homes. So I don't think it would be fair, especially given the fact that, and this is not our fault, but like, when you have a committee like housing not meeting 3-4 months, and we have a housing crisis, to some extent, I think that we can lean into, you know, the situation with immigration a bit more, because we can maybe provide some insight that's possibly not coming out of housing because we're not even able to meet and that does fall in our purview. So with that, I would love to have, like maybe 2 central topics we focus on, but I don't wanna I don't wanna make that decision alone, and I don't want us to make it at the expense of other things, you know, so I don't think that shining a light on a few things means we have to forget about others, because we have time to do at least 3 presentations a week, a month. So we can divvy up how we're, you know what I mean? And we can figure, I think that's what I'm talking about, is figuring out, how do we want to manage this? Yes.
I was just gonna say 2 things. One, I think we all know people are complex. And so we have many identities. So I identify as many different things. So older people identify as many different, so there's a lot of intersectionality. So just because we focus on one topic or one group doesn't mean we're necessarily excluding others. And I think part of why I structured this the way I did, and it might not be clear, is I'm very interested in people's both professional expertise and their interests, because I think, especially if we're going to be tasked with or volunteering for additional work beyond our committee, ideally it's something that we're interested in and passionate about, and it's not something that we're all obviously all very caring people, that's why we're here in the space, but I think especially if it's extra work, you wanna be interested and motivated. And I think there could be other things outside of areas of interest or expertise that you recognize as a significant need in the community, whether it's from personal observation or data driven or both. So it could be, I think this is really important, I know nothing about it, or I know very little about it, it's not particularly what I'd like to spend my time on, and I think it's important, and I will. So I think there can be, like, I know I have different things, like I do anything for older people, but if you ask me, it's not the first group that comes to mind when I think how I'm motivated.
Yeah, if it's all right, I can share like some of the budget request items that I came up with. That unfortunately we didn't have time to review, but for me, I think like whenever someone's coming here and talking to us and we're like voting on something, there should, like, as it said, like should be something in the budget, like reflecting that. And not to say that's gonna be like tailored to every single person that comes in, but just based off of like the past year or so, when we were thinking about our budget requests, I thought about like gun violence. I think there should definitely be something that we're requesting starting gun violence, especially that we know that like it is like something, I'm sure, you know, as like a PA, that like doctors are taking this on as like a public health crisis, not just something that needs to be like worked on within individuals themselves, but really from the top down. Also, I think promoting health literacy in East Harlem, and there is like, I mean, with Columbia nearby, NYU is not far, Mount Sinai, I was able to actually find like studies that were very specific to East Harlem. There's like this one study I found said 71% of patients with diabetes were unable to appropriately answer a questionnaire based on the nutrition fact label. So they have diabetes and they're not really able to know what nutrition they're getting from their food. So then something as simple as that. We did a lot of talk about like the closure of Target, but didn't include anything in our budget about access to like healthy and balanced food as well, also related to like health literacy. And then lastly, like addressing high asthma rates, which I haven't finished research on that one, but I'm sure there's tons out there. We know we have really high asthma rates and that there's more construction coming East Harlem. I mean, some of these are ones I'm very like passionate about from the start, but some like just hearing from people, I'm like, how am I not passionate about it now? Like when like students are coming in to our full board talking about gun violence that they've been researching, like we need to put something, get some funding requests targeted at that and some action behind that as well.
Thank you for saying that, Jen, and we have not had a chance to really on the floor look at these, so if you would be willing, I would love it if you could present some of these next meeting. We'll go through some of them, but we need to put some of them on the record all of them really, just so people can see them. They can see how we're writing about issues, how we're thinking about what we're doing to get community input. So you could.
Yeah, and if anyone wants help like researching, I like to use like the community profiles and then. I teach research, or just in general, like it's not as hard as you would think it is to find East Harlem research because. There are so many universities and different groups around that are doing a lot of research in East Harlem, but aren't necessarily doing anything with that research after, so. If we can help be the mechanism that gets that research, like more actionable items.
It would also be great if we could help to the request that I made to Pauline, if we could help organizations understand how they could use the information. Because I think sometimes information is not used, and folks don't see the benefit of it. They don't see how it may be able to enhance programming possibly, may be able to help them get funding in specific areas, things like that. So I know we can't do everything, but in how we introduce the data that's available, perhaps we could also just, give some examples of how it could be used by organizations of different industries. So it's 7:31. So it sounds like just between now and next month, please add your personal information to the spreadsheet that will be sent to you. You don't have it yet.
But you put it in Drive, right?
I am going to well, actually, I can only shortcut it because you're the owner, so if you could move it, that would be great, yeah. And you can email it to everyone.
It will be under human services.
It will be under human services, good question. It will be, because it is a spreadsheet, it will be under human services and it will be in the folder that is marked forms and sheets.
Forms and sheets, got it.
Forms and sheets, so we don't have any problem.
It'll pick
I
me up.
presume that you would have trouble finding it, but I think I
I do that more for me. So yes, between now and next month, from April, you will receive an email with the spreadsheet and perhaps just a reminder of how to use it. And I will email you, myself or Marlene will email you with the draft letter of support. So at least you can see what they are asking us to, because you asked some great questions, Mark. Maybe there's some things we might want to add on here specifically that they were not thinking to ask. So I'm glad you asked about the $18, because I was wondering that too. It's like, why, so it was good to know.
It's my pet peeve because everybody says they can't do anything about it. It is the most horrific element of all of our healthcare system and hospitals is that you have these overworked, tired people and you have overcrowded conditions and no one is actually addressing. I appreciate that they want to make more money because they're being forced to work so many hours. They want to make enough money to make it, but it's like, the problem isn't that. The problem is that the care sucks because the system is so broken. But I get frustrated because no one's addressing that. They're addressing it as a labor dispute as opposed to a health dispute.
Yeah, I agree. Like what's it called? H&H? What is it called? I think their customer service is worse than Popeyes. So,
I don't know anything about Popeyes. Customer service. I'll take that as a bad statement.
I've gone and I was like, where are the people who work in this hospital? And I was well enough to call an Uber to go to Mount Sinai because it was terrible. And so we're helping people get more money, but the service is trash.
Right.
I think that goes beyond because residents at Mount Sinai are also working 80 hours.
That's what you said. I mean, it's a system or product.
It's like a
some of that
national
energy into
problem. Like, I don't know any residency program that's not working 80 hours.
So
That's unfortunate, because if you get beyond the first floor, the quality of care is.
Well, if you die at the door, you don't
It's
go
not gonna help
anywhere.
you.
There's no one there, and there was no one there, and it was like I said, it was worse than Popeyes. Like, and if you go to Popeyes in East Harlem, it could take a while. And at least at Popeyes, there was someone there. There was no one at the front desk. It was just, it was a ghost town, and I've never been into a hospital that there was no one working in the emergency room. So I think there's more, like Mark says, it's more more about the system. I've never been to any hospitals in
think we should dig deeper there.
Yeah.
We should dig deeper. We also have the task of updating our organizational assessment form to require more information from health and hospital organizations. So to the extent, I mean, we can do that, but also that could be an area that we're looking at, who do we reach out to? So at least take a position on and say, hey, as a community board, we think that it's not so, we do want you to get more money, but we want to see better quality care, and it perhaps means lowering hours or allowing, whatever it is, we think, because you guys work, like, to the extent that folks know, or we're having
I understand what you're saying, but I wish there was a way we could impress upon people to get to the nut of what they're gonna tell us. We didn't need all that time tonight to hear about H&H Union.
You could have just went to the end
It
and
could
just
have
to
been,
ask.
it could have been expressed in about 5 sentences.
I think that there's a process that folks are told to go through. And I think that if they didn't go through that presentation, we would have probably criticized them for not showing us more.
Okay, fair point.
Just because that's what we do.
I mean, independent, I mean, I accept almost as a given that the residents there are underpaid. I mean, that's like accepting the public school teachers are underpaid. That's a given. The question then becomes, as we try to make with budget, it's like, we're gonna make, that happened at the last board meeting, right? We're gonna make a request to have 1% of the city budget be for parks. Where's it coming from? So the idea that some one side of a labor dispute is coming to us asking for support for more money. I'm happy to have people make more money who I think are underpaid. But the question then, what's the consequence of getting more money? I mean, him throwing out the city has a surplus, you all know, no matter what they tell you, I don't know what money is available and what the consequences of that are. So it's interesting to get one side of the story.
The reality of that is, there's the budget that's requested, there's the budget that's agreed upon, and then something like immigration happens, and the budget's meaningless.
Well, that's because we deficit spend like crazy, so I mean, it's the way that our whole budget, the whole governmental structures are set up. It's just very difficult to have a letter of support for a thing I know nothing about, because someone comes to me and tells me I'm underpaid. It's like, I'm sure you're underpaid.
So with that, we have our work, the break as much as you can review. Once they fill out the organizational assessment form, I'll let you know. And it'll be available in that spreadsheet that's tracking it. But with that, we're good. If there are no other pressing comments, thank you all for this discussion. I'm glad that you all engaged. I'm very hopeful for what we are going to accomplish, and we are going deeper than than what's being presented, and that's how we'll solve it, or at least do our due diligence. With that, I'll stop talking. Marlene, we are good. We have any new business, community initiatives anybody wants to let us know about? Anything happening? I think another opportunity for announcements.
And people see just out of curiosity, it's not in our district, it's only like a half a block away from community board 11, that the governor decided to turn former Lincoln Penitentiary into.
He announced all of it.
What was that? Just happened just a week ago. Oh my God, I was like.
The official was just like the big announcement.
Oh, yeah.
They've been in for.
Yeah.
Oh, okay. You guys
So
are.
they've been living in there for a bit.
Well, but that's what the thing, they're not gonna continue to do it, they're changing the structure.
Oh.
I'm not talking about, that's not, I'm talking about they're turning it into affordable housing that people would buy. It's not gonna be an immigrant, shelter any longer. I don't know when they're gonna start construction. But it's an interesting model, because it isn't kind of affordable housing like the other things that I know come up, at least in my short time on the board, that we're talking about. This is actually home ownership that's being promoted, which is a model that makes sense if you really want to invest people in developing a community and a building. So I don't know how to go through a community board. Oakland is the one who got to decide. It was a state decision. I was curious if the community board, whatever Central Harlem's community board, did they actually discuss that or not? All right. I just thought it was interesting piece of news.
Thank you for sharing.
Yes.
All right, let's do roll call.
April Autry,
Present.
Mark Roberski,
Present.
Corinne Hauser's excuse, Brendan Gillespie, Jennifer Meyer,
Present.
Alicia Miranda, Isaac Scott,
Present.
And Robin Sturgeon, present.
Thank you, everyone, for a great meeting. Happy holidays to you, and please get home safely. And, record time.
I'm gonna say that, I haven't been on the committee that long, but that's the shortest meeting I have attended ever.
Efficiency, that's the thing.
Holy mackerel.